Medicare versus Medicare Advantage. So original Medicare with the supplement versus Medicare Advantage. Pros and cons. Well, let's start with the pros. Original Medicare, universal, not excluded to a network. So basically any doctor that, or hospital or professional that accepts Medicare, you have access to, no matter if you're in your home state or if you're anywhere else in the United States and some of the surrounding territories. Then you have a supplement plan that you get on top of that, and you have a prescription D drug plan that you also have with that. Prescription D plan will cost you some money, and the supplement plan will cost you some money. So a lot of people, the single reason why they will not get on a Medicare supplement is usually that cost of the supplement plan. So those rates on those plans tend to go up over time. A lot of folks sign up during their guaranteed issue period, and that's when they're eligible. They cannot be denied coverage by law. They have to be accepted. If you ever want to get a new med sup plan in the future, or you want to switch because the rates are being jacked up with your plan because maybe the carrier left the area or they got bought out, who knows? That happens all the time. If you want to get a new Medicare supplement plan, you have to go through underwriting. And if you don't pass the underwriting, then you either have to keep the Medicare supplement plan that you have and continue to pay a premium that is rising, or you make the switch to a Medicare Advantage plan. You know, when most folks do that, they don't end up going back to original Medicare. So the pros of, like I said, original Medicare is that pretty much can be covered anywhere in the United States through a doctor or specialist that accepts Medicare's payment. The downside is that with original Medicare, you can be covered throughout the entire United States by anyone that takes Medicare. Downside is cost for the Medicare supplement plan. That's really about it. That's really what I can pin it on. On the flip side, Medicare Advantage plans, the upsides, has some basic dental, vision, health options available with it. A lot of them come with a silver sneakers plan, but not all of them. A lot of them come with a prescription drug plan wrapped into the plan, and the premium is $0 oftentimes on a lot of these plans, and they're through quality carriers. So those are a lot of the pros. The cons are, of course, being limited to that network, especially for people in rural areas where they're not surrounded by multiple networks and a lot of people, and there's a lot of doctors and hospitals around, so their options are very limited. It's not as much of a benefit for a lot of those folks. So it really depends where you're coming from, what your budget is, and what your exact health needs are. And like if you're someone who's been on a Medicare supplement, but the rate has been jacked up because you've been on a plan F for 15 years, and now you're thinking of switching, but you're probably not going to be eligible because of health conditions, you're going to get stuck with just having to be on a Medicare Advantage plan in your network. So it's always something to think about as you move forward into your retirement, into your golden years, the difference between the two. And just know that if you sign up for a Medicare Advantage plan, in your first 12 months you have a trial period where you can drop it at any time, and within 63 days of your disenrollment you can enroll in Medicare Original with a Medicare supplement guaranteed issue. So that's another thing to think about if you want to try it out first and see if you like it. Because yeah, once you leave Medicare Original and the supplement, you usually don't end up going back just for cost or health reasons or both. So I hope that was helpful. If you guys have had this issue before and you've been contemplating which side to go through, or if you need to make the switch, put a comment in the comment section and let me know what you think, and you know what your situation is, and see, maybe reach out to someone at Westfall Insurance and we might be able to help you out one way or the other and give our best advice on what we think would make or not make sense for you in your current situation. I appreciate you guys tuning in. Make sure you like the video, subscribe to the channel if you haven't already, because we're going to keep posting content daily on this thing to keep American seniors informed on everything Medicare and everything senior benefits. So thanks for watching, guys.